everyone, and welcome to video A of our A to Z series, looking into increasing health information accessibility for people everywhere. Today's video on the letter A is going to look at access to health information. Now, what are some barriers to accessing health information, you might ask? Well, this could include things as simple as language barriers or people's education or reading level, where their understanding of certain terminology due to one of these factors might not be the same as yours. For example, if you have a really high-level paper written or posted online somewhere, and certain terminology is either not translatable into another language, where that term really doesn't exist, or is written at a very high reading level, you might have certain people trying to access that information that won't come away with an understanding of what you're talking about. Another thing you can look at is people's digital infrastructure. Do they have Wi-Fi or a computer or even a smartphone? Or is their access to the internet limited to going to something like a public library? And this case, you can imagine, would mean that they likely aren't able to access the internet as often as some of us are. Digital access and accessibility also boils down to factors like assistive technologies, such as screen readers, which may not allow a person to access information in the way it is presented online. Examples of this could be something like emojis in an online post, which can be extremely disruptive to screen readers, and also dynamic captioning, which, again, although visually appealing from a design perspective, is another significant disruption for screen readers. These things play into how information is received by many, adding another consideration to the picture for programmatic and technical elements of digital health information. Lastly, we could look at things like bias or stigma, which might come into play in something like a doctor's visit. The doctor might explain or omit certain information based on his perception of the patient. And not being aware of his own bias in that process, this might lead to less information being transmitted to the patient. Now, what are some impacts of these things on people's health? Well, for one thing, we know that having more knowledge allows you to make more informed decisions about your health. So any situation where a patient doesn't have a full understanding of their options is going to mean they can't make fully informed decisions about their healthcare. They might miss potential treatments or lifestyle advice in these situations as well. This also might affect clinical trials because patients who can't access information about clinical trials won't know whether or not it's something they should talk to their doctor about or something they should enter into. Now, what can we do to improve healthcare information access? For one thing, when we look at digital resources such as websites, we can work on better translations for those sites that are more accurate, making sure that terms are translated correctly and come across appropriately to the intended audience. We can then also make sure that these translations or just text in general caters to lower reading levels to make sure that more people understand more of what you're saying. And this can apply to print materials as well. We also want to make sure that those digital resources are easy to use and navigate, especially for people who have low digital intuition. And we want to think about other considerations such as, again, what makes sense to the user when navigating through your site and where to look for certain information. We would also want to look to build applications and websites that are accessible by design, which could then be tested with a free resource, such as accessibilityinsights.io, to make sure that existing content doesn't fall into some of the traps we previously listed when encountered by assistive technologies. And lastly, of course, we can look to remove our own personal bias. This can apply to medical professionals, medical communicators, and others, where we want to make sure that what we are transmitting is transmitted properly to the recipient, of course, taking into account that communication relies heavily on knowing who your recipient is. Again, so this is an important consideration for us. I want to thank you for joining us today and invite you to join us next time for Video B, where we'll be looking at better health outcomes.